Now, a WBAL News Radio Town Hall special, The Coronavirus. Here with Brian Neiman is C4 on WBAL News Radio 1090, FM 101.5, and the WBAL mobile app.
You know, it's incredible to believe that after Maryland Governor Larry Hogan signed the state of emergency order on March the 5th of this year, that now we are entering our 9th week really in this whole new environment, COVID-19 coronavirus. And we appreciate the relationship that we have. We're here at WBAL News Radio 1090 and FM 101.5 with GBMC Healthcare, as we are now having our second The Coronavirus Town Hall special, where we're going to have experts on from GBMC Healthcare, Dr. Theodore Bailey, many-time guest also with Brian Neiman, who is co-hosting again with me today, host of WBAL News Now in the morning. Dr. Theodore Bailey is head of infectious disease at GBMC. We're also going to be joined by the president and CEO of GBMC Healthcare, John Chessare. And then we're going to be joined by Laura Clary, who is a clinical program manager for GBMC's Sexual Assault Forensic Examination. The acronym for that is SAFE. And then we're going to be joined by Dr. Jeffrey Mindel. He's an endocrinologist on staff at GBMC. I want to talk about the issue of how COVID-19 impacts people with diabetes, high blood pressure, the term we've heard before, comorbidity issues. Brian Neiman, I tell you, we're into this now for over 2 months now, and having this relationship with GBMC and being able to do this is fantastic.
No, it's great. I mean, there's a lot of topics to cover, so let's get right to it. A lot of questions that are out there, I know that, and if you've got one, you can text us at 410-467-WBAL. But let's bring on Dr. Theodore Bailey. He is the infectious disease doctor at GBMC. Great to have you on. I'm curious, there's a lot been made about this drug, remdesivir. I don't know if you've used it or not, but are you treating patients with it? And if you have, what success are you seeing with this drug?
So remdesivir is a medicine that was recently received emergency use authorization from the FDA. Some clinical trials had shown that it reduced the duration of symptoms. It unfortunately was not proven scientifically to reduce the risk of death or the rate of death from infections. It's a medicine we'd like to use because it still is of benefit, but it is a medicine that is being regulated in terms of where it goes and which hospitals receive it. We have not received it. The federal government is controlling right now where it goes, I believe directing it to particular hotspots, but that is a medicine that can only be accessed at certain hospitals.
Dr. Theodore Bailey's on board with us. And Dr. Bailey, over the weekend, New York Governor Andrew Cuomo was talking about this new part of this disease, maybe, we don't know for sure, that might be affecting children, pediatric multi-symptom inflammatory syndrome. Apparently, there's only about 73 suspected cases in New York, and there have been just a couple of fatalities. What do you know about this and its relationship with COVID-19?
Well, it's quite a new phenomenon, and as you mentioned, it is actually quite rare. It's been seen actually in some folks in whom the testing for the COVID is negative, so we're not sure that it is or how closely related it is to COVID. One of the things, if you look at the people who are really looking at it closely, it has similarities to non-infectious rheumatological syndromes. Those are kind of what we call autoimmune syndromes. And it may be that some people's response to COVID-19 is setting off this excessive immune response. And we've seen a different version of an excessive immune response in patients. We call it a cytokine storm, where the normal immune response is so exaggerated that it's actually detrimental to the patient. This may be something like that, but I must say right now our understanding of it is very preliminary. But we are seeing it in children. The fact that we're seeing it clustered in places is also a little odd, because we would expect it, if it's just a rare condition related to COVID, we would expect those cases to be scattered everywhere, but rare in each place instead of clustered. So there's a lot yet to understand about it.
Well, on that note regarding kids, do we have a better idea about why they are not seeing the symptoms that adults are, and if they do spread the disease to adults? What do we know about that as of today, Dr. Bailey?
Well, I'm afraid because it is often the children are without symptoms, it often doesn't come to anyone's close attention. So I can't say that we know a great deal yet about the lack of severity in most children. That's the flip side to the cases that you just talked about. And what I would say, one of the main differences between children and adults, one of them is just the maturity of the immune system. It's not reached full development yet, and that would be one possibility, but it is still being explored. Certainly, children would be a concern as potential carriers of COVID-19, and that's part of the rationale that's been behind the school closures. It hasn't been only a concern for the children's health, but also the fact that that creates a link between the parent of a child to that child to the people that they go to school with, and then that child back to their parents. So it would be a bridge between households in precisely the ways that we've been trying to prevent through social distancing.
We're pleased to be joined on board by Dr. Theodore Bailey. He's the Chief Division of Infectious Diseases at GBMC Healthcare. It's our Townhall Special Number 2, the coronavirus. And Dr. Bailey, when it comes to the issue of herd immunity, particularly recently, now that we're reopening, 47 states now, I think the number is, are reopening. What about the possibility of people kind of being exposed to each other and positively developing the herd immunity situation?
So herd immunity through actual infection is precisely the wrong way to go about developing immunity, because it means that you actually have failed to prevent infection. You've actually led to individuals becoming infected with all the expected risks of death and severe illness. So that we still have not seen as many infections as we have seen, and we're talking up in the, over 1 million. You're talking about a much larger population of people in the United States and worldwide who have not had COVID-19, who are as yet not immune to it, and who would be expected to have the same likelihood of severe infections that we've seen so far. So we're not at a point of herd immunity, and gaining herd immunity through simply people becoming naturally infected is precisely what we're trying to avoid, since that will lead to the kinds of death rates that we've seen so far.
The number of people getting coronavirus in Maryland, right? It's Baltimore, Washington, D.C. That seems to be the epicenter in our states. And also older people, or at least are dying from it. If you could give us an idea, a ballpark figure of who the typical patient is at GBMC suffering with coronavirus right now.
So the typical one, and we're going to see some variations around this, would be someone in the sort of 60 and up set, more in the 70s and 80s for the severe infections. But we've had very severe infections outside those upper age groups. They often will have some other health issue, diabetes, perhaps heart disease, perhaps chronic lung disease. This seems to be one of the risk factors for it becoming more severe and requiring hospital visit and even maybe requiring ICU. Those are, again, only the typical patients, but we'll see the younger, seemingly healthy individual at times who also gets a very severe case. And I have taken care of a number of healthcare providers as well. People who've been taking care of other COVID patients and then become a COVID patient themselves.
Last week, Dr. Theodore Bailey from GBMC Healthcare, Governor Larry Hogan began to ease us back into his 3-phase recovery to reopen Maryland. It's not quite, I call it phase 1 light, because we're really not in phase 1. But what do you think about the easing of restrictions in this atmosphere we're in, Dr. Bailey?
It has to be done very carefully. And I will say that one of the things that's probably phased in over time is also just our familiarity and our comfort collectively with using masks, with using hand washing and such. But I will say that it's important to think of the COVID-19 pandemic as much more like a forest fire or a house fire than it is like bad weather, which as it starts to get better, continues to get better, regardless of what we do. One of the things that we may see in some areas is decreasing numbers of new cases, but we're still seeing new cases, which means there's still transmission despite the social distancing that we've taken so far. And like a forest fire that's getting better, typically the firemen would not stop at that point and say, well, yes, there's fewer trees burned today, but if we simply walked away from that, those trees would then reignite all the unburned trees. And that's really what we're looking at here. We have a large number of still vulnerable non-immune individuals in all communities. And if we were to simply say take a jump into removal of social distancing, all of them, we would expect the smaller number of cases that we might be seeing to really blossom back up again as a raging forest fire. And so I think that has to be done with people still really carefully using their masks, using their hand washing, and still limiting what they do to what they really need to do. If they can stay in the house, they should stay in their house.
One last question before I let you go on this one is, do we have a better idea on how it is transmitted? I was talking with a friend the other day. His brother had it. He slept next to his wife for several days before he showed symptoms. His wife never got it. And now we're hearing you can maybe get it through your eyes. I mean, and it's safer to be outside than it is inside. Do we have a better sense of how this coronavirus is transmitted, Dr. Bailey?
Well, we know, I think the fundamental things that we know about it is that the primary route of transmission will be respiratory droplets. And those will tend to drop as they leave a person's respiratory tract. That's the basis for the 6 feet of distance that we recommend. And you may see the stripes now at grocery stores and drug stores. We also know that when it lands, it can persist on surfaces for a time, which is the basis for recommendations for aggressive cleaning of high-touch surfaces. We do this obsessively in hospital settings, which means you could come into contact with it, get it on your hand, touch your face, touch your nose, touch your mouth, get it in that way, even if you weren't within 6 feet of a person who was coughing at any time. So obviously being out in shared spaces certainly puts you in areas where you might touch things that someone else has left respiratory droplets on. That's why hand washing is important. It's always a chance, though. So if you come into exposure to somebody by contact or by respiratory, it's still just a matter of possibility. Now, you should think of it a little bit along the lines of a roulette wheel. You can spin that wheel several times and win or lose. When we come into these kinds of contacts, it just puts us at risk of acquiring it. But we know that a lot of people have lost that roulette wheel. They have acquired it from coming into the right kind of contact and have become quite sick. So it is a roulette wheel that a great number of people have lost on so far.
Dr. Theodore Bailey, the Chief of Division of Infectious Diseases at GBMC Healthcare, we always appreciate your expertise, and I'm sure you don't mind moving over as we bring your boss on board. I truly appreciate it, Dr. Bailey. Thank you very much.
Thank you, Dr. Bailey.
You're listening to WBAL News Radio 1090 and FM 101.5, The Coronavirus, our Town Hall Special number 2. Joining me is Brian Neiman from WBAL News Now in the morning. We're pleased now to be joined by Dr. John Chessare, the President and CEO of GBMC Healthcare System. First of all, good morning, Dr. Chessare.
Good morning.
Thank you very much
for having me.
Thank you very much for being on board. I'm going to turn it over now to Brian Neiman.
Well, I was just wondering, and you've obviously have seen, people in the hospital who have coronavirus. Do you feel that the hospital has adequate PPE for all the people who are dealing with this coronavirus outbreak?
Yes, we absolutely do. For right now, especially, we actually have a small number of patients in the hospital compared to our usual volumes. And every clinician going into the room of any patient right now is wearing an N95 mask and a face shield. We clearly have enough PPE for the present state. The big question will be, as we ramp back up to normal operations, will we have enough going forward into the future?
Dr. John Chessare is on with us, once again, President and CEO of GBMC Healthcare System. And Dr. Chessare, when it comes to the issue, Governor Hogan last week announced that hospitals now can begin to conduct elective medical procedures again. What is GBMC Healthcare's timeline on that, and how do you resume that?
So let me take the second part of the question first. We do it in a very marked way. We've had a team working on this for weeks. You were just listening to Dr. Bailey. This is a virus that obviously can kill, and we need to be very measured. So we've had a team looking at all the evidence, assuring that we have appropriate personal protective equipment for all of the staff who will be involved in the care of people requiring so-called elective procedures and all of the patients. We've also begun our planning to test every patient who is going to have elective surgery or an endoscopy, for example, for COVID-19 before they have their procedure. And our timelines on this, actually today, we have begun the scheduling of elective surgical cases and endoscopy cases. And starting next Monday, May 18th, we will begin COVID-19 testing on site at GBMC for all the patients who are scheduled, and we want to have those tests done in the 72 hours leading up to the procedure. We will begin the modified surgery and endoscopy schedules on Thursday, May 21st, and we will then have a gradual ramp up to full occupancy of our operating room and endoscopy suite schedules.
Well, obviously, those are a big chunk of money, revenue for the hospital, if you will. I'm just curious as to how concerned you are that patients or that potential patients, people in the public, are not going to the doctor now, not going to the hospital with some serious illness because of the coronavirus. Do you have an idea about that, Doctor?
Yes, we're very concerned about that. So, first of all, I want to thank Governor Hogan. I think he's done an excellent job. He has given deference to the experts. He has had internationally recognized epidemiologists at his side, and he did the right thing way back on March 13th by announcing the closing of schools and the beginning of social distancing. On March 14th, GBMC saw a dramatic drop-off in patients coming to the emergency department. We went from 130 visits on average per day down to 80 in one day. And that drop of 50 patients per day actually got more, and now we're back to roughly a delta of 50 patients per day. We believe that those 50 patients were people with chronic health issues who are now somewhere out there, and we just hope that their issues are being addressed. Let me give you the simplest one to understand. You know, there's a lot of talk about screening tests. Well, the one screening test that no one argues about, which is absolutely shown to save lives, is colonoscopy. Scheduled colonoscopy according to your age and your risk absolutely saves lives. Well, we haven't done elective colonoscopy now for 6 or 8 weeks, and we want to get that testing going again, because we don't want somebody developing colon cancer and having it be missed because they were not screened. So I want to assure all of your listeners that if they need colonoscopy for colon cancer screening, that they should get it. We will do the appropriate things to keep them safe.
Dr. John Chessare, President and CEO of GBMC Healthcare System. We truly appreciate your time, sir, and we appreciate the relationship we have here at WBAL with GBMC Healthcare. Thank you, Dr. Chessare.
Thank you very much. We appreciate the relationship with you as well.
You're listening to the Coronavirus, our Town Hall number 2, right here at WBAL News Radio 1080 and FM 101.5 and GBMC Healthcare. Stay here.
The WBAL News Radio Town Hall Special, The Coronavirus, continues. This is WBAL News Radio 1090, FM 101.5, and the WBAL mobile app.
And Brian Neiman along with C4 here for our WBAL Coronavirus Town Hall number 2 with GBMC. We're talking obviously a lot about the virus itself and the impact it's having on the hospital. But what about the impact it's having on relationships as well? Laura Clary joins us now. She's a clinical program manager for GBMC's Sexual Assault Forensic Examination, Safe and Domestic Violence Program. Good to have you on. You know, we've often talked about how, you know, maybe we're going to see a baby boom or maybe we're going to see a divorce rate go up. I am curious, do we have any strong numbers to indicate that the number of domestic violence cases has gone up during this pandemic?
So from our experience, our numbers have actually went down, which is something that we kind of anticipated because, unfortunately, with people being stuck in the home, they're unable to get to us at the hospital a lot of times because their abuser may be controlling them, or they may just be afraid to leave the home and come to the hospital because they're choosing to stay healthy over, you know, their safety, which, you know, is okay. It's an individual choice that each person has to make, and we understand that. But we are seeing an increase in patients using hotlines and calling into domestic violence hotlines for information. So we're getting that information from our community partners that have 24/7 hotlines available.
Laura Clary, once again, Clinical Program Manager for SAFE and the DV program over at GBMC Healthcare. What steps have you taken in your programs, Laura, to maintain social distancing and protect, like detectives, the patient, everybody?
So we have changed as far as providing personal protective equipment for all of our nurses, all of our advocates, and as well for our community partners. So when a patient does come into the hospital and they're brought into our unit is separate from the ER, which is really nice. But we make sure that everybody is protected. We also provide this to the patient. It can be a little bit scary for somebody to see, a healthcare provider in all of the, the masks and the caps and the visors. So we went and made pictures of all of our staff so that we can wear them on our scrubs, so they can see what we look like underneath of all of the protective equipment that we're wearing.
So if your numbers are down, but you're saying the hotline numbers are up,
mm-hmm.
are the victims here getting the help that they need?
So the ones that come into the hospital, we do still provide service 24/7. So we are always available. It doesn't matter what time of day it is. It doesn't matter if it's the weekend. We are always available for when someone presents to the hospital. We do think that there are a lot of people that are in abusive situations that are just unable to get to us. And those patients aren't, getting the services that they may need at this point. So we do anticipate once some of the social distancing and some of the lockdown is loosened a little bit, we are going to see a pretty dramatic increase in domestic violence patients and child abuse patients coming forward and seeking help.
Laura Clary from the SAFE program and DV program over at GBMC Healthcare. What are some of the ways that people may be experiencing abuse by their partner during this COVID-19 situation?
So again, being stuck in the home with somebody, it's also a very stressful time. It's stressful financially. You have kids that, aren't in school anymore, so it may be a child care issue that's putting on stress on the family. So this in general is a very stressful situation. So we see that when stressors are increased, that the domestic violence also will increase. And again, with being stuck in the home and unable to leave to get help, a lot of these victims are, just experiencing it in the home and unable to get to us. But we see domestic violence in lots of different forms. So a lot of people, when they think of it, the first thing they think about is physical violence. But while we do see that, it's a lot more to that. There's, emotional abuse and financial abuse. And even when it comes to someone being denied medical care, if they are having, a medical emergency or need to come to the hospital or need to go to their physician, their partner not allowing them to get that help that they may need.
You mentioned child abuse. I don't know if you specifically work with children, but do you have an idea of the impact the virus, the pandemic, is having on child abuse as well?
So our program provides care from birth till death. So we see patients across the lifespan. So one of our services is providing treatment to victims of child sexual abuse and physical abuse. And it's the same thing. A lot of times kids are disclosing in schools. So when there is a sexual abuse situation, they go to school, they're telling their school resource officers or their guidance counselors or a teacher, or they're telling a friend who then goes and tells a trusted adult. So now you have these kids that are stuck at home a lot of times with their abuser, and they don't have a way to tell somebody what's happening to them. So we anticipate when schools open back up, we are going to see an increase in disclosures of sexual abuse of children, because they, again, have that safe person that they can tell, what's happening to them. That's
fascinating. So, because kids will tell their teachers or somebody within the school that will notice it, and they'll pick up on it. And because kids are not at school right now, we're missing those opportunities.
Exactly.
Wow.
Laura Clary from GBMC Healthcare. When it comes to domestic violence victims, I'm sure a lot of women particularly don't want to leave their children in a situation where now COVID-19 is forcing the kids to be at home. How do you counsel women that, you can still deal with domestic violence reported without leaving your children?
So that's really interesting. When we care for our patients that come in, we try to care for the family unit as a whole. So we understand that there's a lot of reasons why victims may not leave that abusive situation, and sometimes they will say, I don't have anywhere to go with my children, or I don't want to take my children to a shelter, and that's okay. But we'll try to figure out ways and safety plan with them so that they have a safe place to go, whether that be someone else that's trusted within their family. Whether that be just staying in that situation until it is safer for them to leave. We see this not just with children, but we also see this with pets. Pets is a really big thing for people when they don't want to leave, is they're afraid to leave their pets behind. And a lot of shelters, you can't take your pets with you. So even, sometimes it's not children, or someone may not have a child, but they have a pet, and they don't want to leave that situation because they're afraid to leave that pet behind as well.
Do you have any idea when it becomes, I hate to use the phrase normal, but to a normal level that you would see with the calls that you get, the people who you deal with, where people are, is it, a year from now, is it a vaccine, or, as the economy starts to thaw and when we get out? What is your thought, your prognosis of when we get to that point again?
That I really I'm not sure. That's not my area of expertise. I do know that we are working on vaccines, and I would hope that we would get to a point where a vaccine becomes available and we can use that to to decrease the frequency that we're seeing this. But honestly, I really can't give an expert opinion on something like that.
Well, I'm talking about for people who are saying we need to get out of this relationship, or there's abuse happening. Is there a point within the economy opening up, or people not locked in their homes, the stay-at-home order? Do you have an idea of when that might be for those people who feel willing to at least come forward and report the domestic violence or even child abuse?
So I'm thinking, just based off of what I've seen with the governor's orders and when they anticipate things getting back to normalcy, is that, potentially, in the fall, even going into next year, is when we kind of are going to see things returning to normal, where people will be out more and will be able to, get to somewhere safely and not have so much concerns about the virus.
Laura Clary, once again, Clinical Program Manager for GBMC's Sexual Assault Forensic Examination, SAFE, and Domestic Violence Program. If someone knows that somebody's experiencing domestic violence or partner violence, what would you say to them right now in this environment if somebody knows what's going on?
I would always say that just to be there to support that person. Make sure that person knows that they did not deserve this. Nobody deserves to be a victim of domestic violence or sexual violence. This is not their fault, and they're not alone. There are services out there, and while they may feel alone right now, they're not. Very
good. Laura, great to have you on. Really appreciate you coming on the show.
Thank you so much for having me.
Yeah, Laura Clary is the Clinical Program Manager for GBMC's SAFE program and Domestic Violence program as well here on WBAL. Coming up next, we'll talk with Dr. Jeffrey Mindel, endocrinologist, on the underlying health conditions that we're seeing, especially with those who are in the hospital with coronavirus and those that are dying of coronavirus. This is the WBAL Coronavirus Town Hall number 2 with GBMC on WBAL.
Now, more of the WBAL News Radio Town Hall Special, the coronavirus. This is WBAL News Radio 1090, FM 101.5, and the WBAL mobile app.
Yes, it's our Town Hall number 2. I'm C4, joined by Brian Neiman, as we try to bring you the great information that GBMC Healthcare is helping all of us ascertain. Joining us right now is Dr. Jeffrey Mindel. He is an endocrinologist on the medical staff at GBMC and a physician with Bay West Endocrinology Associates. Brian?
Well, we often talk about, Doctor, the underlying health conditions that are serious for anyone, but especially for those over the age of 65 dealing with coronavirus. What exactly are they, and why are they impacted by the coronavirus?
Well, yes, we all are hearing on the news that people with so-called underlying conditions are at increased risk. In my specialty in particular, we deal with a lot of diabetics, and it has been found that anyone with diabetes is at much increased risk of having a more severe illness and at increased risk of death. We're very early in this disease, and data is being gathered from all over the world, from different countries, examining patients. So it's hard to have exact, precise numbers on increased risk of things like complication and death. But just kind of anecdotally from around the world, people with diabetes do have an increased risk of death, and it is a very serious population to look at.
Dr. Jeffrey Mindel, once again, endocrinologist on the medical staff at GBMC. We all know to social distance, and particularly if you probably have some underlying condition. But what can patients that you see, and what can they do to protect themselves?
Probably the same advice that's being given out to everyone right now. Definitely take the social distancing very seriously, quarantine at home if possible, and then if you must go out in public, practice the guidelines as far as wearing face masks and hand washing. I think the real challenge is going to be in the coming months as some of these restrictions are lifted and people are allowed to go to work, leave the home, go to more public venues, that those people with underlying conditions or the elderly should certainly continue to follow the practices, even though they're being relaxed for other people.
Do we have an idea if they're more susceptible to get the virus, or is it just that the symptoms are worse with those who have these underlying health conditions?
So no, the people with diabetes are not more likely to get COVID-19 than the general population. The problem that diabetics face is primarily a problem of worse outcomes, not a greater chance of contracting the virus.
Dr. Jeffrey Mindel, which symptoms and warning signs should you look out for as it relates to this?
So certainly, if anyone develops difficulty breathing, shortness of breath, pain or pressure in the chest, confusion or kind of bluish lips or face, fever, all reasons to immediately contact your healthcare provider, or if those people aren't available to contact, to go to the emergency room.
There are, obviously, you know this better than I do, different types of diabetes. Does it make a difference if it's type 1, type 2, juvenile diabetes?
So there does not seem to be a difference inherent in which type of diabetes one has. Whether someone's a type 1 diabetic or type 2 diabetic doesn't seem to impact their risk. It's much more important the patient's age or their complications or how well they've been managing their sugar more than what type of diabetes they would have.
Dr. Jeffrey Mindel, once again, endocrinologist on the medical staff at GBMC and a physician with Bay West Endocrinology Associates. What makes a person with diabetes, Dr. Mindel, more susceptible to viral infections?
So a number of factors. One, someone who's had diabetes long-standing, particularly if it's been in poor control, has a higher risk of other health issues. So someone can develop heart disease or kidney disease over time from high sugars, and those complications also make the virus more severe for them. Also, when one has an infection, their immune system, the white blood cells go to attack the infecting invader to the body. Having higher blood sugars actually makes that response more sluggish, and the white blood cells not as effective. So anyone with higher sugars has a higher risk of complication with any infection.
Well, one last question before I let you go, Doctor. And that is, we say diabetes. Diabetes is widespread. I mean, what's the population with diabetes? And obviously, we've seen the death rate in African-American communities pretty high as well. What about that angle to the general population and why, this is such a big deal with coronavirus?
Well, roughly 34 million Americans, which is about 1 in 10 people, have diabetes. So this is a large segment of the population that has the potential for increased risk of more severe complications and deaths from the disease. So again, people that fall in that segment should be taking the social distancing very seriously, should be making efforts to monitor their blood sugars as much as possible and make sure they have a good supply of their insulin, make sure they're taking their insulin, and make sure they're in regular contact with their physician to help manage their diabetes so they don't increase their risk any further than they need to.
Dr. Jeffrey Mindel, once again, endocrinologist, I thank you so much for your time, sir. 34 million people diagnosed with diabetes, Brian.
And hypertension is probably even higher than that. I mean, and you add all that in, obesity is a factor as well. I mean, that's why you got to do your best to try and stay healthy. Some of these things are out of your control. You know, some people get diabetes at a very young age, hereditary, but, you know. A
lot of it's dietary.
Yeah, absolutely. So, look, it's amazing to me, you know, the more we talk about the coronavirus, there's still so much that we don't know.
Absolutely.
And I think that's so frustrating. I'm sure it's frustrating for the doctors as well, but just, you know, for everybody who's out in the public who's trying to figure it out, what they can do, what they should do.
But one of the things they
don't
should
know
do, Brian,
everything about this thing.
But one of the things they should do, and I think this came out strong in this show, please, if you have health issues, don't avoid the doctor. Try to keep up with that now that the governor is loosening some of the restrictions.
No, I know. It's like, you know, it's like an airport during a thunderstorm. You know, all of these airplanes are stacked up and they're ready to land. They're just waiting to get the go-ahead. You wonder what it's going to be like whenever that dam breaks or the storm clears, of what it's going to look like at these hospitals, the amount of people who will be going there for either elective surgeries or for, you know, hey, didn't feel good for the last 2 weeks, and it turns out, you know, I had a heart attack, or you had a stroke, and what it's going to do for the general public as well as for the hospitals themselves.
We want to thank Dr. Theodore Bailey, Laura Clary, Dr. Jeffrey Mindel, and the president and CEO of GBMC Healthcare, Dr. John Chessare. We really are committed here at WBAL News Radio 1080 and FM 101.5 to bringing you these town hall specials, which will bring you expert information from folks who know what to do through this COVID-19 nightmare. Thank you, Brian. All the producers, everybody, GBMC, thank you.